you're on a golf cart. We've all been in a taxi cab where the person drives with the foot on the brake and the foot on the gas, and you're going back and forth the whole time, right?
Yep.
Growing a startup to a scaled company is really a function of how much you're willing to admit, hey, I'm wrong, and I need to slow down, or we're not going fast enough. And being willing to toggle that back and forth, it drives you crazy. It's hard, but you have to start with measure it, but then you act on it. Follow, you can trust your instincts, build a plan, you're willing to say, I was right or wrong. You own it. So you earn the right to innovate. They're twins, innovation and execution. So if you're executing, you're earning the right to innovate. So now that you've earned this, how do you take this precious gift of innovation and put it in the most impactful way? And so people talk about falling in love with the problem. People talk about making sure that you understand, the journey you're on. All of those are true. But I would say that the common denominator for me is we're always actually trying to measure the value of the innovation. If the cost to build was gone, the cost to deploy was zero, if it was up and running today, so what?
Welcome to the Brainwaves podcast by Opus, where we sit down with industry leaders to unpack their journeys, explore key challenges, and talk about how they're shaping the future of behavioral health and healthcare technology. I'm your host, Sean Rickenbacker. Today, we're joined by Andy Flanagan, a healthcare technology executive whose career spans startups, global enterprises, and frontline care delivery. Andy leads Iris Telehealth, a telepsychiatry company connecting patients to mental health providers, and he has previously served as CEO for companies in medical imaging and virtual care. We'll talk about how telehealth is becoming just part of healthcare, what it takes to scale innovation in this industry, and how to tackle challenges from provider shortages to technology adoption in behavioral health. Andy, welcome to the show. It's great to have you here. But to start, would you share a bit about how you first got into healthcare and how that early experience influenced your leadership journey?
Yeah, so I've been in healthcare in and out my whole career, really. I started out basically calling on materials management, the bottom right-hand corner of a hospital system in the basement with paper everywhere. So it's been a great journey. I love all the innovation. For me, I think transformation is the fundamental driver, how I think, what excites me. Healthcare has been going through a transformation really in the last 12 years. Probably haven't seen it in 80 years. And certainly AI is exciting. However, healthcare is on a march that we should all pay attention to. And as consumers, sometimes patients, we should all be excited about where we're headed. So that's what got me in here, and that's what keeps me here.
Absolutely. Saw, obviously, like we're on LinkedIn and all that, saw that you had been at Iris Telepsychiatry for the last 5 years, since like the middle of COVID. Tell me about that.
Yeah. So I really joined Iris for the culture and the mission. Clearly, behavioral health has struggled from a scale perspective. And, we need big companies in healthcare. Be efficient, be quality caregivers. It requires scale. And reimbursement's low. We're not running enterprise software companies. We have patients in the middle, people in the middle. So when I came to Iris, it was founder-led. I've been a founder, and the mission was right. Certainly the timing really couldn't have been better, if you will, for so many companies to address the mental health stigma. And we've seen great progress in the last 5 years. But that's really why I came here. The mission and the journey is still vibrant. We have a lot more in front of us than we have behind.
Absolutely. Tell me more about the mission at Iris.
Our job is to deliver quality care in some of the most difficult settings and patient populations. We're domestic in the United States today. And so we're in emergency departments, medical surgical floors. We're in community mental health centers, health systems. We're dealing with Medicaid patients, Medicare, pediatrics. We see over 1 million patients a year, 1/3 of which are pediatric. We are prescribers. We have an employed model, so we employ 30 outstanding clinicians, 2/3 of which are prescribers. And so that really means we're handling the most acute patient journeys and the moments of time where we need to be stabilized. We need to be met where we are and get appropriate care. So that's really the journey and the mission for Iris. We do that by leaning into our own culture, and our values are pretty clear. We remind ourselves why we're here all the time. And there's a patient in the middle of our discussions, and there's a clinician in the middle. That's really the magic.
Absolutely. We talked previously, you mentioned AI being a huge advancement, especially in behavioral health, but it's so important to keep the human a part of it, right? Like you said, you've got patients in the middle, clinicians in the middle. I want to talk a little bit about like I guess what you've done at the company you've been at. You said that you've been a founder. Iris was founder led. I know you've worked at various different sizes of companies. How do leadership challenges differ across those environments, and how have those experiences shaped your approach?
Yeah, I've been blessed to be with, senior roles with some of the largest companies in the world and be employee one. I left the corner office overlooking a golf course, the top floor of a building, to being in office 10 by 8 with no windows and no furniture.
Yep.
Yep. And with strong partnership in the team, we ran that startup for 7 years and sold that successfully. And that was a fantastic journey. The reality is that, have to be able to address your modality to the situation that you're in. We all went through this period of zero interest where things were easy. Money was easy. It's not a natural state for any company to have money be easy. And it tends to make one a little bit lazy or a little bit fast and loose or grow too fast. And now all of a sudden profitability is going to be a challenge. What I would say is that we've been profitable for years, and it's because we've balanced innovation and execution. And that's really the lesson that I carried with me for being in a startup and running large commercial organizations and multinationals is that you really have to balance what you're doing in a planful way. And as a result, even though when I came into this startup, I had to build a management thesis and a culture and a management process. And this founding team did an amazing job to build a profitable $20 million business over the course of 6 or 7 years back in the early 2010s. Grown fivefold since, and we've done that profitably because we actually measure what we do. We plan, we hold ourselves accountable. So it sounds so easy, but in this world of venture, private equity, sometimes it can be dislocated. Like you forget, you believe your own press release, you believe AI is going to do all this stuff, but the reality is you have to train your employees on how to use the technology. So really having both of those experiences has been a huge asset for me. And I try and flex that inside my company. And our employees and our leadership very seasoned. They have startup and they have large enterprise experience. I think both are very valuable, both independently, but especially together.
Absolutely. It's that diverse experience coming together and being able to bring that into a cohesive environment and being able to have those perspectives that allow you to work efficiently.
That's right. Yeah,
All
exactly right.
With Iris Telehealth, I know you've talked that you scaled fivefold since 2020 when you started out. Is that right? Wow.
Yeah.
That's incredible.
Teamwork makes the dream work.
Teamwork makes the dream work for sure. I know that at least in our company, we talk about these different like books that we follow as a North Star. Right now, we follow the four disciplines. Sorry, we call it 4DX. So I never see the full name all the time. But are there any books that you use as a true north at Iris?
Yeah. So there are 3 books. So It, Blue Ocean Strategy, Crossing the Chasm, Innovator's Dilemma. So those
Okay.
3, like they're on my bookshelf. I'm actually rereading Crossing the Chasm right now. There are times where industries kind of sort of go through this transformation. And so even though it's not a new book, it's appropriate for that industry in that moment. And so the Blue Ocean Strategy was effective in the beginning because nobody really thought you could build a successful company, a profitable company in behavioral health.
Absolutely.
And so you had we chose to work with health systems and provider organizations, not sell to payers and not sell to employers. And I affirmed that strategy when I came in because of the underlying economics and patient journeys. And as a result, in general, many of the people that are selling to payers struggle to be profitable. Many of the people that sell to pay employers struggle to be profitable. High revenue growth, high gross margins, negative EBITDA, kind of a problem. So we all have to kind of sort of decide. But for me, I think, especially coming into a new entity, you have to start at the beginning. The second thing at Crossing the Chasm is I came into a successful company. It was profitable. I mean, it was not growing very quickly and it wasn't scaled, but they did a lot of things right. And so, it wasn't a story of like, oh, I have to tear this down and rebuild this. My prior company, I took out of bankruptcy. That was the job, and that's a very different journey than I came to here. And so Crossing the Chasm was much more appropriate, for the operating model in 2021, 2, 3. And so right now, we're in a different phase. So
Absolutely.
different books, different phases.
Yep. Different seasons of life and company modality, right?
That's exactly right.
Love that. I love that. And you said you scaled quite significantly since 2020. What's next for Iris Telehealth then?
Yeah. We're leaning heavily into AI,
Mm,
but not in a clinical way. So a lot of the AI in healthcare is around ambient listening and listening to the clinician and creating the note. And you see a lot of heavy dollars, over $1 billion has been
mm,
spent on companies that are in that segment. We're not in that segment. That's not our journey. There are a lot of systems of records, Epic, Cerner, Oracle now, that will solve that journey. And a lot of independent companies that are already off 3, 4, 5 years into that space. We are much more around patient engagement, enablement, the administrative side of behavioral health. The no-show rate in behavioral health for an appointment is twice as high as it is for any other condition. So you have a scarcity of the clinician, and then the patients show up at a lower rate. So that gap, meeting me where I am, may not have money in my tank to be able to drive across for an appointment. I may not be able to take a day off, right?
mhm,
So the tele side of Iris Telehealth solves a very specific problem as it relates to Iris, access rather.
mhm.
And as a result, we have a sustainable value added position. Now, what I'm going to tell you is tele will go away.
Okay.
Now, I'm sure
Tell
you're
me
saying,
about that.
how can you say that? Because that's the name of your company, right?
Yeah. Yeah.
It
Tell me more.
will go away, Sean. Like, if we do our job, it will go away. People will just accept the fact that it's just another modality. There's plenty of clinical evidence that says an encounter virtually for behavioral health is as effective as an in-person encounter. Now, when you're getting a new prescription, you need blood work. You should see somebody in person. If you have SMI, there's appropriate journeys that really it's important that you're face to face. But given the number of people, 40% that have stress, anxiety, mild depression, this is a very effective modality. And many health systems and community organizations are adopting it. We're trying to help them. Like we want them to be able to do it on their own. We don't worry about us having a job. Unfortunately, there's always going to be a role for us because access is such a problem. But it really is about trying to bring tools out of the box for the provider organizations in our world to retain the patients in their circle and inside their systems so they can deliver high quality care. And continuity of care is the main thing. So virtual is just a tool, but it's like a must have now. It used to
Absolutely.
be, wow, that's interesting or that's innovative. Now it's table stakes. That's my view.
Absolutely.
Yeah.
And it feels across the board with telehealth and behavioral health is just if you're doing a good job, you're helping people, you ideally work yourself out of the job, you'll have to find something new to do, you know? If we can just help people, suddenly we're able to if we can help enough people, we need less people that have to work in this specific capacity.
That's exactly right. Yeah, there is such a negative trend towards access.
Mm,
The number of clinicians that are retiring in 5 years, people aren't going into psychiatry. Now, the nice thing is that a lot of people are coming into therapy, so that's a really positive thing. Because therapy combined with medication management, combined with a psychiatrist, is a very powerful combination. You don't always need to go see a psychiatrist in
yeah,
any of these patient journeys. You really see a psychiatrist once a quarter and you're a therapist for a period of time. So you graduate. That's the ideal story. So yeah, you're right about that. I also find it super interesting to watch the reimbursement world. So we're seeing right now the government's talked about this one big beautiful bill that they passed, right? Negatively impacting the Medicaid funding, especially in expansion states. So there are some political undertones to that. However, patient journeys across the country in Medicaid are going to be impacted. And we're going to need to lean in. We're going to lean in with technology. We're going to lean in with alternate ways to provide support, continuity, help people be compliant. And those technologies are flying around us. I mean, you have a great lineup of all your podcasts that you go through that list, and
yep,
every other one is some form of an innovative solution, right?
yep,
That's why I'm optimistic, Sean. We really are asking the right questions. And we have a bunch of really intelligent people in the world that are working on trying to solve part of this problem. So,
absolutely.
yeah,
It's like I said, we've got clinicians that want to help people. We've got software companies want to help clinicians help people. We've got their admin that want to help them help people. We've got a whole line of people who want to help people, help people, help people, right?
That's exactly right.
Love that. I know you talked about a psychiatrist shortage, and of course, we have rising mental health needs. In what way is Iris helping to close that gap? And what challenges do you see in reaching any high risk, underserved, maybe rural patients?
We are specifically deploying data science algorithms to actually try and meet the patients before they escalate. And that's really the key. If we can keep people at home, out of the emergency department, the resources that are dedicated to reactive care, stabilization, can be redeployed to proactive care. And data science can help us. We have successfully built several algorithms that are quite effective, and it allows us to leverage the data that we already have to predict who's likely to utilize an ED in an emergency department. And then we have a care pathway that engages that patient directly. And that pathway can be just borrowed from us by our customer, and they can do it themselves. We're more than happy to do that. The key, though, is we're offering a turnkey solution so that not only do we suggest, hey, here's a technology, here's a tool, and here's what you should do. If you can't do that, we will do it ourselves.
Hmm.
In our view, always have to blend people, process, and technology to bring a complete solution to the delivery organization. They're just stressed, right? The regulations are getting tighter, the administrative burden's getting larger, reimbursement's getting lower, right? So it's a pressure cooker. And
Yep.
so when we think we are doing something that's helpful, we really have to be willing to do the whole job.
Absolutely.
And that's why, we frankly always have jobs, right? We do work a lot.
Absolutely. Bringing it back, Andy, I know that you've led like medical device companies and now telehealth. How did you approach innovation differently when it came to cutting edge hardware or software versus a healthcare delivery model in telepsych?
Well, the first thing that's the same is you have to start with defining the problem and really know who you are. So you earn the right to innovate. They're twins, innovation and execution. So if you're
Mm,
executing, you're earning the right to innovate. So now
love
that
that.
you've earned this, how do you take this precious gift of innovation and put it in the most impactful way? And so people talk about falling in love with the problem. People talk about making sure that you understand, the journey you're on. All of those are true. But I would say that the common denominator for me, whether it was my software company, whether it's the medical device, or whether it's Iris Telehealth, is we're always actually trying to measure the value of the innovation. If the cost to build was gone, the cost to deploy was zero, if it was up and running today, so what? So like AI, hey, we have AI, right? Right now, people are building AI for valuation reasons, right? Like, hey, I want to be
Yep.
a unicorn. I want to be, you hear it all the time.
Absolutely.
Yes. And so let's just own the fact that of the 32,000 companies that have been funded with AI, there'll be about 320 that make it. Okay. So you're really talking about a funnel. Why? Because it's super early. And as it gets later and later, the bottom of the funnel is going to get wider because the problem that they solve will be a more mundane problem, not esoteric around, my phone is going to tell me when I need to go plant the crops today at 3 o'clock for whatever reason, right? Like very, very, very nichey thing that frankly is really cool, but maybe not necessarily creating a lot of value. So I would say that the number one thing for me is making sure that the output is worth the input, that we're doing it for the reasons of the problem, not financial reasons, so for valuation, not for ego reasons, so I can be on a podcast and say, no, right? Like none of
Yep.
those matter at the end of the day.
Mhm.
That would be it. Output.
I love that. I love that. And it goes back to what you said about always measuring everything and making sure that you are accountable and you're executing. I know that you'd mentioned when you came to Iris, you were handed kind of a golden company. Things were working well. They were profitable. What are some things, some challenges you've overcome since you started at Iris?
Yeah. So all those things are true, and it was completely not scalable. So the art there was how do we keep the good part of the company, the culture, the mission, the values, objective management, practice, and then talent that knows how to scale, that has done that, has gone from 20 to 200, and do that in a way that keeps the main thing the main thing. I always talk about the main thing has to be the main thing. In this case, we're a medical group delivering care. Yeah, there's a lot of technology, there's a lot of other stuff, but let's not forget, in the end, about a patient and a clinician, we're helping that happen. That's our job.
Yeah.
So it really is a series of, if you're on a golf cart. We've all been in a taxi cab where the person drives with the foot on the brake and the foot on the gas, and you're going back and forth the whole time, right?
Yep.
growing a startup to a scaled company is really a function of how much you're willing to admit, hey, I'm wrong and I need to slow down, or we're not going fast enough. And being willing to toggle that back and forth, it drives you crazy. It's hard, but you have to start with like, you measure it, but then you act on it, follow through. You trust your instincts, build a plan. You're willing to say, I was right or wrong. You own it. So for us, our value is suck less every day. So suck less every day means if I make a mistake, I'm going to own it. I'm not going to repeat it again tomorrow. I made that mistake. That is
Yep.
one of our values at Iris. And I love that value. At first, I'm like, it's a cheeky startup value and all that stuff. But as I started kind of, you know, working inside the company, it really came forward as a way to teach people it's okay to fail here. Like I don't, as a CEO, have a rear view mirror. My
Yeah.
first question is not how did that happen or who did this. I don't ask those questions. The only question I ask is about something like what's the
Absolutely.
next most important decision we have to take right now? Where are we? What's the right next decision? And so that living in that world, the grind, and it has to be a grind showing up. If it's not, you're not working hard enough. You're not falling, you're not skiing hard enough.
Yep. Yep. Absolutely.
That's it. And so you got to be falling. And no,
Yeah.
not everyone likes that. It's like, man, I keep like bleeding, like I'm bleeding again. Like this is like, what is it, mayhem?
Yeah. The commercial. I know what you're talking about. Yeah.
Like mayhem. Like working in these companies is like mayhem. You got to be comfortable with it being rough and tumble. And I love that. I love that tension. And I hire people that love that. And you know what? We're a bunch of scrappers and it works. So it's not easy work. It's different work than being a pure startup. And, another good example would be in big companies, they have innovation teams, right?
Mm.
And the execution profit engine is always trying to kill the innovation team, right? Why? They show up with some slides. They go, isn't that great? And everyone goes, that's great. They sit down and then the head of sales gets up and they're like, why'd you miss your number by 1% on $3 billion? Like, what's going on?
Yeah.
Throw me a bone, right? Like he's got PowerPoint. I'm managing 6,000 people.
Yeah.
So this is real. These things are hard, whether it's a big company or a small company. But once you have venture money, people think like, oh, then it's fine. Like the hardest part is over. In that moment, that is true. The day of reckoning arrives. Venture capitalists are not corporate managers, right?
Yeah.
They're participants. And now you're going to manage the business. And so if you're a technology founder, which I've been, you have a certain job, you're building something. But if you're using a technology like a wrapper on an LLM, okay, so now you actually have to own the business outcomes and the value prop. Now you're in the game, right? That's real
Yeah.
work. So anyway, that's a couple of digressions there, but that's just a little bit about the journey. It's a constant journey. Even right now, we just finished a 60-day strategy rewrite just to make sure that we're being agile. And it's painful to ask yourself, like, what could we have done better? And how do we go faster? And where's more value for our patients or our clinicians? We feel good having done it, but it's tough work. You have to force yourself to do it.
Absolutely. Yeah, like you said, looking at kind of what's gone right, what's gone wrong, how do we fix that? It's painful. It's tough. Planning for the future, the strategy is painful. It's difficult. But like you said with Mayhem, if you're not getting roughed up, you're not working hard, right? Those are just the, I don't want to say workplace hazards, but, in essence, those are the workplace hazards. I know that company culture is something you've talked about. And of course, it's crucial in healthcare. How do you foster a culture of innovation and empathy at Iris that helps to keep clinicians engaged and teams motivated?
Well, we have a team of people that wrap themselves around our, and their job is to stay close, fundamental, the right way to say it. Empathy is really the main thing. You have to start there. The moment you're talking to a clinician, you don't know about the patient they just finished talking to. And with 1/3 of our consults being pediatrics, there's some really tough patient journeys there. It's not like, primary care, where maybe half of the patients are checkups and half are high acuity. I'm making that number up. In mental health, especially in psychiatry, it could be that 8 out of 8 were hard encounters, right? And so I think that empathy and understanding the journey and the job we do is the first thing. Second is we have a very strong recognition and rewards program that includes and focuses on our medical group. And we do a lot of, we're Joint Commission accredited, so like grant rounds, things that help clinicians, get better, time to recharge, sharpen the. So it's hard. We have a very high NPS score in our medical group. 91, but it's real work. And I think the most important thing is that, uh, our chief medical officer and our chief operating officer are dyad, that the two of them, the real answer is they keep this as a top priority. And as a result, priority throughout the organization. And I rely on them for that. I respect the way they manage that. It's a really hard part of our business.
Love that. I love that. And it's the making sure you prioritize your team, having that empathy, building that culture that works together. Like you said, with scrappy startups, you sometimes end up with those values that feel quirky and fun, like suck less every day. But if it works, right? You stick with it.
That's exactly right. Yeah, you stick with it. And we're, 12 years in now, right? So we're sticking with it.
Absolutely. Absolutely. For others in the behavioral healthcare space aiming to innovate, what advice would you give from your experience bridging the worlds of technology and patient care?
Yeah, I think the important thing is around reimbursement. I think the hard part is not finding a patient journey that should be better, nor is it finding a clinician who could be looking for, a more efficient way to work. Those aren't hard to find. The hard part is getting paid for it, recognized for the value created. And so starting small in a region with a payer, with a provider, starting with a specific diagnosis versus I'm going to handle all of mental health is really the right answer so that you're building a strong foundation. When you talk to, a clinician or a medical group that handles one diagnosis versus another, they could be far enough apart that they're specialized and they don't. If they're handling, mood disorders, they don't want to work on substance abuse and vice versa. You go to a hospital and you see everything. So you really have to kind of pick your place. It's really no different than innovating in enterprise software. You're going to work on supply chain, in tech, or right? The distribution, where you're going to be. It's really very analogous. We all have heard the maxim of like, hey, we're just going to solve a problem with data. We're just going to solve healthcare with data, right? A couple of really smart folks come out, build a data platform, and it answers every question, but it does nothing. There's no punishments of good. Active patient saw this with at Yale, with the patient health record, Microsoft, Google came out with for all your medical records. Go over there, and that's free, and I don't have to manage it. And so it was a great technology, and it worked the way they designed it. By us as consumers with our medical data wasn't painful enough that we were willing to, and it's the same for behavioral health. It's a very diverse, complex area of medicine. It's quiet, so you can't just walk down the road and see it working. See a cast on my arm, I broke my arm. I can't tell if I have anxiety. Walk down the street. So you really have to be purposeful to get the return on capital. There are plenty of venture private equity firms that are heavily invested in mental health, and they really fit their swim lanes. They really know their business. So you see their thesis playing out very specific ways. Yet another data.
Absolutely. Andy, it's been fantastic having you on the show. It's been a great conversation. I really appreciate your insights in the industry and healthcare in general. I always ask this question. I know I asked before, what books does the organization follow? But are there any book recommendations you have personally?
Yeah, so I'm reading right now Zero to IPO. And, it's just a function of hyperscale attitude. Like, how do you keep your jam like on go big, go fast? And it's easier the bigger you get to not think that way. How do you go from a couple $100 million to a couple billion? Well, why are you focused on that problem versus something else? That's what I like doing. So I'm just kind of putting myself back into going big mindset. And so that's a great book for people that say, hey, how do you want to think aspirationally? It's super small and thin. It's not a very big book, you know.
Okay.
Full summer read for it. Right? Summer's over. But
Yeah.
Weekend.
I'll check it out. I read a lot, so I'll check it out. Sounds
You'll
like
enjoy
a great one to have. So awesome, Andy. And again, thanks so much for being on the show. I'm sure our listeners will love hearing your insights.
Thanks, Sean. Appreciate what you do as well. I've enjoyed your content, and thanks for having me today.
Of course.